look at some strategies for maintaining spinal health throughout all chapters of life. A few housekeeping little bits and pieces. Like I said, people will be coming in and Dr. Cream will sort of mute things, but if you notice your microphone's muted, if you could switch that off, that'd be good. And then also the camera down the bottom, you're welcome to have that on, but it's a bit distracting for me, so please turn it off. And just if you want it on, make sure you're aware that everyone can see you if you do have that on. If you have any questions, if you can hang on to them till the end would be good. We normally do this face-to-face, but because of COVID, we're stuck doing this online, which is fine. But I can't take the questions as they come as easily that way. It's just a bit distracting. So down the bottom here, hopefully your screen looks like this one that I've got on my my little thing here, or on the side here. You should have a little chat button on the side down the bottom there somewhere. If you scroll your mouse down to the bottom, a chat icon should come up. Pop your questions in the bottom there, and I'll endeavour to get to them at the end there. Hopefully I'll leave enough time. Just fix my timer up that I didn't start. I have an extra minute there. So hopefully we're recording this. We think we've got the bugs worked out there. So if I run through some things you didn't quite understand, and if you get to ask the question, it will be recorded. You can go back to it. And we're hoping to make a little ebook PDF. We'll email that to all our members, just covering all the pertinent points and a bit of a summary from all the things as well. And I'm well aware I talk miles too fast. So if you want to hit that unmute button and tell me to slow down, I don't mind. That's perfectly fine. I won't be offended. You will not be the first person to tell me, I promise. So my name is Dr. Ashley Dent. I'm a chiropractor down Hobart. I grew up in Launceston and lived down Hobart for a year, and eventually went off to Macquarie University in Sydney to study. Was up there for the 5 years of the degree. Realised how much I missed Hobart, and the job was available when I finished, and have been working with Dr. Crean ever since in Hobart and Kingston. I enjoy being very active in my community on a few associations and community groups, and I'm one of the Tasmanian representatives for the Australian Chiropractors Association as well. So today we're covering a few things. I might just move my thing here so I can see what I've written. We're covering mostly osteoarthritis and the exercise benefits of osteoarthritis as well. So what is it and what can you do about it? What is osteoarthritis? And what can you do about those things with exercise and stretching, and along with some of the general benefits of exercise as well. We'll be covering a lot of topics there, including balance and why balance is important for general well-being. Went the wrong way there. So here's some pictures of some osteoarthritis. So on the left here, you can see an X-ray of a low back. You can see the vertebral bodies there, the square shapes. I hope you can see my mouse moving. The square shapes up through there, the vertebral bodies with the discs in between. Now, while we don't see the discs on an X-ray, we can see where the gap they leave there. We can see the shape of them. We can see if they're thinned or not. So the joints at the back as well, we can see that's a nice, healthy-looking spine. There's no arthritis there, and it would probably move quite well. In the middle here, we've got the moderate arthritic changes. We've got some joint changes at the back there. Got some little lipping on the front a little bit there. And the disc here, you'll notice, compared to the ones around it, while there's some wedging on this one here, the height's fairly well maintained. This one here, the height's quite well diminished. Little black line in the middle here, which is called the vacuum phenomenon. Sign that disc's been damaged over time and is eventually worn out, and that's what we're left with. On the far right-hand side, I should say, same processes here, but a lot more advanced. This L4, the second vertebrae from the bottom here, slipped forward quite a bit on the one below it. There's the lines are nowhere near as clean. The discs, all of them have lost a fair bit of height, and they have spurs coming off the front. Don't mind them off the front there, but it's a good sign that discs had been in trouble in its life. And quite significant changes through the back of the spine as well. So that's what we call advanced osteoarthritis. So is one better than the other? What's happening here? What age are these people? All of these things would be taken into account to determine what's important to that person. But certainly you can see the differences between the left and the right, and those intermediate changes that we might see through middle years as well. So what causes osteoarthritis? We still call it degeneration, but it's not really a breaking down of things. It's more a stabilization of the spine. It's most of the time a fairly normal process, and if you live long enough, you will get it. There's no doubt that as we age, we do get more arthritic changes. we call more the grey hair of the spine in most cases, like the way our skin gets a bit thinner and doesn't heal as well. The spine tries to stabilise itself, and that's what we see. It's not really wear and tear mostly. Now, if you're a mechanic and you're on, cement floors for a whole career, your knees will probably not like that, and they'll probably, by the end of your career, be a little bit unhappy. So a bit of a wear and tear there, but that's not always the case. We tend to see women get it more often in the hands compared to men, although that's not a golden rule. Even though they haven't worn those hands out over their years, it just seems to be a genetic susceptibility there. So while a lot of people seem to be genetically susceptible, if your father had 2 knee replacements, you're probably going to have knee replacements as well. There are lifestyle factors that have to come into play there. What exercise you do, what mobilities you have through your life that will determine how bad or if you even get arthritis in those joints. We know that movement is the best prevention through your life to a point. There is a point where you can move too much, or if you're doing it in the wrong ways, yes, movement might be deleterious, but as a general global rule, I need to talk in generalities here because I'm not talking to a single person. As a general rule, movement's our best preventative cure. What are the effects? So this is the big one. Obviously, pain can be a part of it, and most commonly is, but one of the bigger things we see is weakness. So if someone has low back, hip or knee arthritis, what we tend to see first, while they might have minor painful episodes in their earlier years, weakness is a big part. They might start to struggle to get off a chair. So as they go to get up, they might need their knees to rise, put their hands on the knees to rise up off a chair, or they'll have to look for chairs that have armrests so they can manage to get up again, even though it's not necessarily painful yet. That weakness to get up off a chair or to get up a high step is really apparent with hips, knees, and low back arthritis. Stiffness is a big one we will always see. As that joint gets arthritic, it can't move as far as it used to, and you'll tend to see stiffness. So if you guys want to try this as well, you turn your neck all the way to the left as far as it can go, then turn it all the way to the right. Is that even, and is it painless? A lot of people, like for myself, I don't get as far to the right there as I do on the left. Maybe that's something I should see my colleagues perhaps. The other one as well for the low back, can you stand up and if you bend down to touch your toes? So I can get down and touch my toes quite well. That's not a problem for me. I get a bit of a pull down the back of the legs, but it's not a problem. Can you do it? How far down can you get? And is it painful? They're things you want to watch. And the last one, I don't know if you can see on the camera there. If you bend down and slide your hand down your leg as you side bend, then you go and how far down do you go? I get my left hand down to my knee here, the crease of my knee. Then I go to my right, and nowhere near as far. I'm probably nearly 2 inches off the distance I made down my left leg as I did to my right. That's something I probably want to get checked out as well. We don't like that asymmetry, that inability to go as far to the left as the right. There's lots of things that cause it. Doesn't mean you have arthritis per se, but it's something you might want to get checked out in the future. Pain is a common issue around arthritis. It's not necessarily the arthritis that's painful, but the inflammation that gets built up around an arthritic joint. That pain's it seems to be more prevalent at night for people when they're less distracted. They're trying to sleep, they're not distracted by 10 other things, and all of a sudden their knee's really throbbing or their back's throbbing. If it's nighttime pain, we usually want to check out nighttime pain and make sure everything's okay there. We want to make sure that that nighttime pain isn't something more sinister, but it's really common with arthritis. Pain is not a foregone conclusion, though. If there's no inflammation present, it's just a stiff joint. It doesn't move very far. I remember my first week of practice, first month of practice, one of my first new patients was the worst spine I've ever seen on X-ray. He literally ran over the mountain for fun. He was an orienteer with no back pain per se, but he could barely get his hands to his knees, let alone down to his feet. And side bending, he just had no movement. So pain's not a foregone conclusion, but it's very common. And that's where the chiropractor might have their biggest impact is reducing the pain so you can keep mobile. I just realised I'm talking fast again. I'll take note of that and back off a little bit. Feel free to let me know to slow down if you need me to. What can you personally do about arthritis? What can you do for yourself to decrease pain, make it more flexible, make it more comfortable? A lot of the research comes from knees. Knees have a big range of motion. It has a simple range of motion, it only bends basically, and it's very easy to access and measure. So a lot of the research got done on knees. We know that cycling is good for knees. If you have a knee arthritic problem, you have a left knee that's a bit dodgy compared to the right, we know if you can get on a stationary bike and use that every day for X amount of minutes, depends on you, the person, the individual, we know that can help reduce the symptoms of osteoarthritis. Walking can be okay for knees, but only if you tolerate it. It's a bit of a mixed bag for people walking for knees. Same with hips, better for hips than knees, but walking is great for the low back. So here's where, here's a problem for me at the moment. I'm trying to target, what can you do for yourself? I don't know what your individual problem is. So you pick and choose what you like here. Walking is good for your back, maybe not so good for knees, unless it doesn't hurt. If it doesn't hurt the knee, walk away, no problem. But walking is very good for your back. Cycling is a bit of a mixed bag for the low back. It helps some, it hurts some. If you have a stationary bike, try it out, see if it helps or not. Mobility, maintaining mobility is one of the key things for spinal discomfort around arthritic changes. That can be done in quite a few ways. We know if you use the joint, it'll be more mobile. Again, you've got to pick the exercise for the joint or the body area that's important. And maybe some stretching is good, maybe some yoga is really good for it. We do have a little session after this regarding stretching with Dr. Sam Crean, who works with us. Make sure you stay tuned for that and get the log in there if you can, if you haven't already. Mobilization. Now, this is what's a bit hard to do for yourself. We know if you have a finger joint that's a bit arthritic, you can distract the finger and mobilize it yourself. That's really easy to do yourself. Outside the fingers or wrists, it's really hard to get mobility through that joint yourself outside of stretching. That's where you might need help from a third party like a chiropractor. They can get in there and gently mobilize joints for you, which has been shown to be very effective for arthritic pains, whether it's hips, knees, hands, low back, neck, it doesn't really matter. If you can get more mobility through that joint, the incidence of pain in the joint, so how bad is the joint, how often is it painful, and how much can you do with that joint before it gets painful, dramatically increases with chiropractic care or stretching or exercise. Combination of all the above helps even more. So getting something done around those joints is usually really good for it. But no matter how much we change the severity of the pain, no matter how much we change the mobility of the joint, no matter how much we change how frequently that joint gets painful, actual reversal of those bony changes we saw in those images earlier, we don't tend to see. Well, that's what the research shows us anyway. We don't see the changes in those joints. So while we might change those things to make it feel better and move better, our goal, chiropractors' goals anyway, is not about changing the actual spine itself. It's about changing how well that spine functions. And that'll be a big combination of what you do for yourself and what the chiropractor does, but you definitely want to be aware that we don't change that image itself, but just how well the spine functions. We know general exercise is generally good if it's not stirring up those arthritic changes too. So whatever you do, it doesn't matter what it is. If it doesn't hurt the joint, it's probably good to do as a general rule. Again, I mean general there. If you have specific issues, get in contact with us. We'll talk about those. But general exercise is generally good for all aspects of health, and it's good if it doesn't hurt those arthritic joints. Absolutely, go for it. So what are the general benefits? What are the general health benefits of exercise? I'll just have a little drink of water so I can keep talking just for a sec, sorry. We know obviously it's good for your musculoskeletal systems, your bones, joints, ligaments. We know, and discs, if you exercise somewhat, you will have benefits in those joints if they're done properly. But what else helps? Cardiovascular disease, so heart disease. If you exercise, exercise your heart, it works better. Just like any other muscle, that's the case. And cholesterol, if you've all heard of good cholesterol versus bad cholesterol, we know that you have a better ratio of that bad versus good cholesterol if you exercise. You won't necessarily have less cholesterol, but you have more good cholesterol, less bad cholesterol. Something that was they looked at this a while back and expected some change, but breast, prostate, and colon cancer, the guidelines now are indisputable. The rates of cancer are much lower in people who exercise. That research is a little flawed in that, people who exercise have lower smoking rates as well, in general in the population. So we did expect to see that, but people who've recovered from breast and colon cancer, if they start to exercise and weren't big exercisers before, this is just moderate exercise. We're not talking about jogging or, high intensity exercise, just getting out for a walk. moderate pace walk, dramatically reduced the recurrence of cancers returning in those people. This was for breast and colon, I think, might have been prostate and colon. If they've recovered from those cancers and then they get out and exercise, they have much less incidence of recurrence. And if they're undergoing treatment for any of these, so they're undergoing chemotherapy, they have a much better quality of life, they feel better, they're less anxious and have less depression as well, and it increases their rates of recovery from that disease as well. So this is for those 3 cancers. There's others that have moderate levels of evidence for them as well, for the cancers. But these are the 3 that were just blown out of the water by how much they improved. Obesity. This is probably a bit of a slam dunk obvious one. If you exercise more, you have less fat, but not necessarily less fat, you're not less obese, but that fat distribution is a lot better. I'm going to talk about that in a little bit of detail because it pertains to the back as well as it does to the back pain that people experience around arthritic problems. But the fat distribution, so fat's supposed to be laid down under skin, not around organs and inside the muscles themselves, what they call organ fat. If you exercise more, you don't lose fat if you don't change your diet. Excuse me, but the fat will be better distributed around the body if you exercise. Type 2 diabetes, this is a sugar regulation problem in your body. People who don't exercise and have poor diets are at a high risk of getting diabetes. If you're borderline, I just have very low insulin resistance in your diabetes, not high. If you exercise, you can actually reverse it if you change your diet along with it. So we know diet alone helps. Diet and exercise is much better, and they've actually shown reversal of mild cases of type 2 diabetes by adding that exercise to it as well. So some things that people expected to see, but again, just the amounts of change they saw in the research was quite dramatic. That provides some incentive for you to get out and exercise. That was what that slide was for. This is one a bit more relevant to us chiropractors who work with the musculoskeletal system and nervous system. We know that if you exercise, the earlier you start, the better, but it's never too late to start. You will slow down the loss of your bone density and your loss of muscle mass as you age. Unfortunately, there's a few things written in stone as we age. You will lose bone density and you will lose muscle mass, what's called osteoporosis and sarcopenia. They're both normal problems with aging and they're a bit unavoidable. Same thing with the skin changing as we age, same thing with eyesight, same thing with those osteoarthritic changes as we age. But all of this can be offset with exercise, not stopped entirely, but massively slowed down to the point of near stagnation in some people if you get out and exercise. And this is where you might need a bit of help if you have already been diagnosed with osteoporosis. You may want some professional help from someone like a chiropractor to say, this is what's probably best for you. So specifically with osteoporosis, weights might be a little bit better than walking, but a combination of the two is probably better too. So getting a little help around that. But in general, if you haven't been diagnosed with these issues, or you haven't got a lot of loss of muscle mass yet, picking up some exercise now is vital if you're not doing a fair bit already. Here's a slide of a 40-year-old triathlete, cycling, swimming and running, quite a intensive exercise. A 40-year-old triathlete's thigh muscles, this is his thigh cut through it in an MRI. So here's his bone here in the middle, the femur, with the fat inside. The fat comes up very white there. I hope you can see my mouse moving. Inside that little black ring is quite a white bit, that's the bone marrow. And around the edge of his leg here, all the subdermal fat, the fat under the skin, that's where fat's supposed to be. You can see fat in between the muscles, but all this grey on the outside around the bone, that's always very healthy muscle. There's no fat inside the muscle itself. Same thing on the other side. He's probably an injury in the hamstrings here. Perhaps there's some fat infiltrating in that one on the right-hand side. But he's 40 years old. We'll forgive him that, I reckon. But overall, a very healthy person there with the fat where it's supposed to be. Huge, thick bones here from repetitive exercise and nice, healthy, non-fat infiltrated muscles. Now we compare a 70-year-old sedentary person. Now, the stark difference here we'll see straight away is the fat around the outside. Lots more adipose tissue there, fat tissue, but that's where the fat's meant to be. So not a big problem there from a general health point of view. But what we do see here is the fat inside the muscle. It's all what we call fatty infiltrating the muscle. If it's here in his femur here, it's in his leg, It's probably going to be around his organs as well. And then we've got a much thinner bone. The actual width of that black circular bone, much less. If you look at this guy's here, massive, massive difference on the right-hand side compared to left, and poorer muscle quality here. That's obvious here. If you bought that steak from Woolies, you'd be very upset compared to this one. So we don't like to see that fatty infiltrate there. It's a big problem. Now, if we compare, if I can go back a slide, you can see this guy, he was 40 years old. What I didn't say here, this guy on the right is a 70-year-old triathlete. So I don't expect everyone to be a triathlete. This is probably a high bar to set. But if we compare the pair here, there's a massive difference here. And if we compare the 40-year-old to the 70-year-old, it's very hard to see a difference. This guy's maintained a high level of health with that intense exercise. Now, can this guy on the left, the 70-year-old sedentary person, become this guy on the right? That's not possible anymore, unfortunately, but there's huge changes he can make. I mentioned that marbling in the muscle before as well, because we know that's a big predictor of pain as well in arthritic things like the low back. If you have low back arthritis and we see that marbling, that fat infiltrates in the muscles of the low back, it's a very good predictor you'll have pain. If we can exercise and remove the marbling, get the joints working better, get some mobilization with a chiropractor, any of those things combined, we know you can change your pain outcome and reduce that marbling and the fat as well. It seems to come along together as well. That's why I mentioned that earlier as well. So this guy can't get to this guy, but he can make huge changes. So I'll get to the next slide in a sec with a 92-year-old woman. But the main point is it's never, ever too late to start. And the earlier you start, the better. Moderate exercises benefit, moderate being not triathleticism, please. Don't start that now. But moderate exercise is beneficial at all stages of life. It doesn't really matter what you do something, providing it doesn't aggravate those arthritic changes if you have any. Walking's good at a faster pace. Resistance exercise is probably better. But a combination of the two is, if you had to pick one or the other, you pick resistance exercises. That's the stretchy band exercises, the set to be fit exercises, those sort of things. Something that involves some sort of weight. If you can do both, it'd be better. We know walking is good for your bone density. We know resistance exercise is good for your bone density and your muscle mass as well. So you preferably both, but they're both really good. If you have to pick one, it doesn't matter, do something. If you have something stopping you, now if you can't walk around the block because it hurts your back, well then you probably want to see someone and get some actual advice about what you should be doing, what can you be avoiding, what can you be doing differently. Is there something the chiropractor can do for you that gets rid of some of that pain, that gets you more mobile? That's where a chiropractor might be much more beneficial, just to get you out the door and doing something and give you advice around what could be good and what maybe is not so good for you at that point in time, potentially. Oh, I just forgot to say as well, can I go backwards? Coming back. There we go. Same thing with hips and knees. Some exercises might be better than others. I mentioned cycling before for knees, may not be so good for the back. Again, the chiropractor would be the best person to ask about that if you had any issues there that you want to sort it as well. So here's that 92-year-old woman I promised. This is her on the left. And then again, 12 weeks after resistance training in the leg. This is that MRI slice of the thigh again, same as the three gentlemen earlier. Here again, here's the bone, that black ring around through here with the bone marrow inside. The fat in the skin around the outside here. And then a fair bit of fatty infiltrate all through the muscle there. She was quite sedentary before she started this exercise. This is a single case study, so don't draw big conclusions, but bigger studies have been done. I'm just using the picture of this lady, because it's quite dramatic. This is her after 12 weeks of resistance exercise, her gentle weights on the legs and picking those weights up as she could under the supervision of a professional. The striking difference here is the muscle mass. So you can see just the width of the thigh here compared to the left-hand side over just 3 months. Big difference. When they measure it as well, now they can measure the difference between the darker muscle and the lighter fat infiltrate with the MRI, with the computer program. She had a massive reduction in her fat infiltrate. She still has the fat around the muscle, which is probably what you can see quite clearly there. but that fat infiltrate is much less all through the actual muscle belly. That's what we want to see as chiropractors. And when they measure the width of the bone and the density of the bone with the computer program as well, that changed statistically as well. So, and that was over a large population. We see big changes in that bone density too. That's what we want to see. Sorry, it's a little pop up there. So that was only after 12 weeks of resistance training in a 92-year-old. So if we take an 82-year-old and do the same thing, we see orders of magnitude quicker and bigger improvements. If we see a 72-year-old, we see more orders of magnitude difference there. Things happen quicker and better, and they heal better. They have less adverse events when they're younger. So the quicker the earlier you start, the better. But it's never too late to start, as this 92-year-old woman shows in the study that she came from. Big changes and happening in relatively quicker timeframes than people probably would have expected. Just looking at, from general thoughts. Here's the big one, balance. So we know if you have poor balance, and there's ways to measure this that a chiropractor or occupational therapist might do, but if you have poor balance on certain scales, you will have a very high risk of falls in the next couple of years. Falls are probably the biggest problem as we age from a health burden point of view. The falls get exponentially more risky as we age, and they become exponentially more likely as well. But we do know if you improve your balance, which is very possible, you just got to be diligent with exercises. If you improve your balance, you improve your falls risk. And if you improve your falls risk, you dramatically reduce your risk of injury later on in life as well. The tests we use, we do run through a gamut of tests to measure, we don't want to start at the hard ones, but ideally as we age, we want to see you at least standing with your feet together, like this lady with feet together. I hope you can see the picture there. She's got 1 foot off the ground. I want to see my people standing with 1 foot off the ground with their eyes open. But we try, feet together, eyes open, hands off hips. Can you do that for a minute? Can you stand there without teetering too much or shifting your gaze, shifting your foot? Can you do it with your foot off the ground with your eyes open? Can you do it with your eyes shut, with the feet together? Make sure there's no hard corners, don't do it in the kitchen. Can you do that with your eyes shut, with your feet together without having to stop and open your eyes? Can you do it with your eyes open, with your eyes shut? That's with your eyes open, I should say. Please don't try that at home because you can fall a fair way before you realise. Can you stand with your eyes open like this lady in the picture here? She's got a foot off the ground but not touching her leg here, and her hands aren't on her hips. You don't need the arms way up in the air there, just as long as they're not touching the hips. Can you do that for 1 minute? This is the one thing I'd say. If you cannot do that with your eyes open, you probably should get some help. That's something, there's exercises you can look up and do, but I'd rather you saw someone and figured out what's causing it. Is there just an ankle issue there that's causing a problem? Is it a hip issue? Is it a back issue? Is it a neck problem that can often disturb balance quite significantly as well? Is there a bit of vertigo from an inner ear problem? We want to find out, why is your balance not so good? Is there something you can fix? Or is it just generic aging issues that you need to work on that you could work on and improve and dramatically reduce your falls risk? So if you're having balance issues, if you can't stand with 1 foot like this lady in the picture with your eyes open, I highly recommend for 1 minute, and have 3 goes at it, by the way. Try it for a minute. Oop, can't do it. Try it for another minute. Can't do it. Try it for a 3rd minute. I did it. Man, that's fine. That's okay. But give it 3 goes. If you cannot do it after 3 goes for 1 minute with your eyes open, I definitely want to just touch base with someone and check what they can do for you. Rule out all the other things that might be causing problems. And if there's no other problems really in the way, then you need some exercise to start improving that falls risk as you age. Again, if you can't do that at 30, you definitely need to work on that. If you're 60 and you're trying it, we allow a little bit of wiggle room there, but you still want to start now. You don't want to start when you're 80 and your falls risk is already through the roof. So definitely starting earlier is better. If you're 80, you still want to start doing something. So definitely improving that is a definite go-to thing we want to do. I'm seeing some questions popping up. I'll get to those in a minute. Oops, just stop that. There we go. So in summary, Osteoarthritis is not inherently painful. I'm just going to move this so I can check if I've missed something. Osteoarthritis is not inherently painful, but tends to be for people, unfortunately. There's lots you can do about that, including general exercises you can do, mobility exercises, stretches. We know all of that stuff helps. General exercise helps with osteoarthritis. You may want to see a chiropractor because we know they can help with, and general exercise as well in combination. We know it can help with the frequency of osteoarthritic pains. We know it can help with how often it gets sore, and we know it can help with how much you can do before it gets inflamed and angry. So a big common one I see as well is people in the garden, there's 20 minutes and I'm done, I have to stop. I'm all right by the next day, but if I do 20 minutes in the garden, well, I'm shot for that day. For some people, it's just a case of sitting down, having a cup of tea. They're good to go for another 20 minutes. That's probably not such a bad thing, but if we can make it an hour, that's a big win for that individual usually. Obviously, the chiropractor will work with your own personal goals. What do you want? I just want to walk around the block. That's fine. We work within your goals. But there's plenty you can do for yourself and plenty someone should be able to do for you if those things are a little bit unobtainable for you at the moment. General exercise definitely helps out osteoarthritis. If it doesn't aggravate it, this is where my general talk here falls out of touch. You have to pick something that doesn't hurt. But general exercise and moving that joint should help that osteoarthritic joint. And it's very good for your general health and well-being for lots of things you may not realise as well, as I pointed out in that other slide. We know that balance is a poor balance is a very good predictor of falls. The better your balance is, the much less likely you're going to fall in the next 5 years. The worse your balance is by certain scales that we measure, the much more likely you're going to fall in the next 5 years and have a decent injury. Again, definitely try that 1 foot standing. If you can't do that with your eyes open, don't try it closed without supervision. I'd normally stand there with my hands either side of you to make sure you don't hit the wall or a shelf or something. Do it with the eyes open. If you can't do it, I'd definitely give someone a call and see what they can do for you. What are you doing now that you can improve? So have a think about it. Do you get out for a walk? Is something stopping you doing that? Is there some resistance exercises you do or would like to do, but maybe a shoulder's stopping it? Rotator cuff injuries in the shoulder are big issues as we age. They just become much, much, much more likely. They get very painful if we try and do some upper body, resistance exercises. What are you doing now? What's stopping you? What do you need help with? What can you achieve right now today? Have a think about it and see what you can do. So try those exercises. Can you touch your toes without issues? Hand down the side of the leg. Is it even? Is it painless? Like I said, I get to my left knee there, the crease on my knee on the left. I'm 2 inches off on the right. I'll make an appointment with my colleagues later to see what's going on there. Neck rotation. Is it even left and right? Can you reverse the car or change lanes without having to get off the seat and look around behind you? Improving that range of motion can have significant changes in your quality of life, not just driving the car, but through lots of things, not having to use the shoulders and the low back to move so much, puts a lot less burden on that low back too. Can you balance on 1 foot for 1 minute with the eyes open, please? Have 3 goes at it, try it on both feet. If you cannot do that on either foot 3 times, 3 goes at it and couldn't do it with the eyes open, definitely call someone and get that checked out, because we know that's a lifesaver, that one. Dramatically reduces your falls risk if we can improve that. Excuse me. I think I missed that one earlier. I'll come back to that. Can you confidently and easily rise up off a chair without using your arms? That's another good one, a good little test we use to measure what's called a frailty measure. Can you just stand up without having to plant your hands on your knees or grab the handrest of the chair and force yourself up off the chair with your arms? Another good predictor of frailty and how good you're doing. A lot of that will come down to hips, knees, and low back, strength or arthritic changes. So that's something the chiropractor works with quite regularly. How strong are you in the low back and the legs? What can we do about it? Is it you that just needs a bit of exercise? Is there other underlying problems in the hips, knees, or low back, ankles maybe as well, that might need addressing before you can strongly and confidently get off that chair? So have a work through that list. Can you touch the toes? Hands down the sides of the legs, are they even? Are they painless? rotating the neck left and right. Can you look around your shoulder when you're driving, for example? Definitely that 1 minute with the eyes open on one foot. Give it 3 goes. If you can't do it, I call someone. And the rising off a chair, that's a good one, just to catch all low back down problem. Is there a problem in the back, hips or knees that I might need help with? That's a really good one just to assess that. We get asked, there's a little bit of misconception about what chiropractors do. I want to run through that a little bit just so there's a little bit of understanding. So chiropractors work with the bones, joints, ligaments and muscles of the body. Our access into that's through the nervous system. We do put our hands directly on those stuff, obviously, but a lot of the change comes through that nervous system. Our biggest role is to keep people moving and keep them mobile. Like I said, we don't see those bony changes. We don't, pain reduction is a thing we do, but our main goal here isn't reducing pain. We might have to reduce pain to get you moving. That's fine, but our main goal is to keep you moving, keeping you functional. When we get you moving and functional, the pain tends to decrease as well. So pain reduction is a big part of what we do. We do measure it, but not above making sure we keep you moving and mobile, making sure those joints that might be seizing up a bit are working well, etc. Reducing pain is a big one, and sometimes we do tend to try and get a bit of help there. While our main goal isn't pain reduction, pain might be stopping you doing some things, and we might have to co-manage with your general practitioner, your medical doctor, just to give a little hand there if you want. That's obviously a personal choice for yourself, but we might have to tap your GP on the shoulder and write them a letter and just say, look, Mrs. Smith we're going well, but the pain's still keeping her awake at night. What can we do? And that'd be a discussion you have with the GP if we're not moving that pain along significantly. So we definitely work hand in hand with your GP if needed. We might get imaging as well. Depends on what we're dealing with. We might need X-rays, MRIs, CT scans. We can refer for all those things, or some of us, like our clinic has X-rays in-house here. We might take those as well. What do we do when you're in here? Well, we take your history and exam, work out what's wrong. We might apply some manual therapy, so that's chiropractic adjustments. We might gently immobilize, like I mentioned before. We might do some rehab, so targeted exercises, that's specific exercises for specific problems. And we might do soft tissue work, massage, trigger point therapy, stretching, active releases, lots of different things we could do for you. All of these things, what will we do on you, the person, will depend on who's sitting here in front of us. So what I do on a 20-year-old AFL ruckman is not what I'm going to do on a 85-year-old lady who doesn't do much, doesn't exercise much. What we do, we pick and choose what you want. We definitely do. We try and tailor things to what you want, your goals, what you can let us do to you. And we make sure that it's safe for you at your age, your capacity, your frailty as well. So we don't just jump on everyone. We tailor it to you, the person. A big part of what we do as well is exercise and lifestyle advice, and hopefully getting, we do these talks on motivation. That's a big one as well. We're making sure you're doing all you can be doing to be good for yourself. So that exercise and lifestyle advice is a very big part of what we do, as well as those manual hands-on things that we do for people as well. We do have a stretching workshop coming up at 2 o'clock. Hopefully you guys got the links for that as well. I'm just realising I'm getting a bit short on time, so we should have got those as well. I'll skip to questions. I saw a few come through here. I'll just get back to those. Oh, sorry, Mike. That was Mike saying slow down. I think you missed at the start there, Mike. Sorry, I said to switch your microphone off. Sorry, just yell at me to slow down. I'm sorry. If anyone has more questions, send them through. I've got another question here from Kirsty, sorry, how many times you exercise per week, number of days, daily, etc.? That's a good question. There are many guidelines for the general population that recommend about 150 minutes up to 300 minutes per week of moderate exercise. That's a quicker paced walk if you can manage it. Maybe do some slow stuff on a bike, something that gets the heart up a little bit but not a lot. You don't get sweaty and puffing. Or doing 75 minutes of vigorous exercise. That might be getting on an exercise bike. It might be jogging. It might be something a bit more huff and puff. You can pick and choose those. You can do the moderate 300 minutes or 150 minutes up to 300, or the 75 minutes, or a mix of the both. It doesn't matter. And you should be doing 2 sessions of some sort of resistance exercise a week as well. So that's some gentle weights, body weight exercise, some sits to stand classes, those sort of things, sit to be fit exercises, Pilates, those sort of things. So two sessions of those a week, and ideally they'd be spaced out over the week. You do maybe 30 minutes a day of moderate activity, 20 to 30 minutes a day, and space those resistance exercises out during the week as well. Ideally they'll be spaced out during the week, but that doesn't really matter. Ideally spaced out, if it all happens on one day, it's better than doing nothing, but you're much more likely to injure yourself if you do it all in one hit, compared to if you space it out nice and evenly through the week. If you want to do it Monday, Wednesdays, Fridays, and do 15-minute walk on those days, let me know. If you do 50 minutes walk 3 times a week and one session of other resistance exercise, that won't matter either. Sorry, I got distracted by a question there. Ideally spaced out, Kirsty, but it doesn't really matter. The actual amount you do during the week is probably more important. So it's 150 to 300 minutes of walking or something moderate activity, and 2 sessions of something resistance-wise, spaced out preferably, but as long as they get done. That's all. Just had a note here from Dr. Crean. If you don't want the mini assessment voucher and ebook, please let us know. Just chuck in the message there. We've got your emails there. We'll just email them out. So it's stopped out there if you'd like. We'll keep an eye on that. We've got a few minutes left. I've still got 2 or 3 minutes there. Does anyone have any more questions? And Mike, you did. Is there anything you missed there? Do you want to just whack it down there? I know I did. Shoot through a few parts. I remembered and slowed down occasionally, but not often enough. Just get these videos back up. And if anyone wants to just unmute their microphone and ask questions, I don't mind either. Feel free to do that. Cool. So we've got no more questions coming through. You should have got an email from us. If you do think of questions, or you don't want to put a public question up here, we've just got a link coming up for Dr. Sam's, stay tuned for Dr. Sam's stretching session. It's coming up at 1 o'clock here. Dr. Green's going to send a link through as well. I hope to the chat, I think you said, Dr. Green. Hope that's what that message means. If you want to email us, just attention the email to me. For the email you got the link from, chuck your question on there, or contact us on social media or email. I'm happy to get back to you, or give us a buzz, if you need to book in an appointment. Don't mind that either. Spinal Health Week, we are doing mini assessments. If you're not already a patient, give us a call and ask for a complimentary mini assessment. Anyone who registered for this, we're happy to do just a quick run through of your posture, probably run through those tests in the office, running the hands down the side, check your range of motion, check everything's okay. We're happy to do that for people as well. Just give the clinic a call and let us know if you want us to do that as well. Otherwise, not seeing more questions. Thanks, Mike. If we, send us through any personal questions through that email, just attention it to me and I'm happy to get to it. Otherwise, I'm not seeing Dr. Crean's link coming through there. He'll probably go to our Facebook page there. There we go. The link went out on that. And we'll hopefully see you over on Dr. Sam's stretching video. So thank you very much, everyone. We do this, something like this every year. Hopefully next year we can do it face to face. So keep an eye out for it next October, and we'll see you then. Thank you, everyone.